Hello, Pain Free for Life members, and welcome to another 10-minute microcurrent training. I'm Dr. Rob Van Bergen, and today, by member request, we're going to be talking about all things neurological and any microcurrent solutions that we might have. So, neurological disorders, this was a very broad voted on term for these trainings, and I would not normally try and cover everything in one go. But neurological disorders, they're medically defined as disorders that are affecting the brain as well as the nerves that are found throughout the human body. And that will include the spinal cord. So structural, biochemical, or electrical abnormalities in the brain, keyword electrical, in the brain, the spinal cord, or other nerves can result in a range of symptoms coming up. So things like paralysis, muscle weakness, poor coordination, loss of sensation, confusion, even seizures. You can even experience pain from neurological disorders that you would not normally experience, as well as confusion and even altered levels of consciousness. Now, when it comes to microcurrent, we don't necessarily have answers to all of these things. You're not going to find a protocol for, say, epilepsy that is going to be different than a protocol for depression or anxiety, or brain fog or dementia. They're all going to kind of fall into a few small general categories. And all of them are treated with the same three treatments or a combination therein of the same treatments. So the first one, and I'm going to run through all these, I'll actually demo them as well. So the first one is vagus nerve stimulation. And I know people are probably sick of me talking about this one, but I'll explain why in a moment that this is crucial to this. Tongue stimulation would be another, and then gamma stimulation of the brain would be the third. Now, crucially, vagus nerve stimulation is a way to calm the nervous system down. So while, yes, what it's doing is it's reducing inflammation and it's putting you in a parasympathetic state, it's also helping to calm a dysregulated nervous system. It's tapping into the system, the body, the brain, everything. It does it all. And it balances this dysregulated nervous system. So again, while you hear me talk of this all the time, there's a reason for that. Just by doing vagus nerve alone, you can often affect like an absolutely massive change within the body. So let's do a quick demo of vagus nerve for people who are not familiar with how it works. So you will need an evolution or a pinnacle for this, because you need the right programs. And when you turn it on, the first thing on the evolution that's going to pop up is the mode 7 to 12 hertz. Now, what you're going to do next is you're going to find your carotid artery on the left side of your body. So you put your fingers there, right? And you're just feeling for your pulse. Once you have located your pulse, you're going to put the Y probe just behind the finger area there. And you're going to put a little bit of pressure in and then pull forward a little bit. Now, you don't have to do that part, but that to me helps you trap the nerve there. Then what you're going to do is you're going to adjust the power by holding the plus button down until you can feel it. There you go. Once you can feel it, you're going to feel it might take longer than it took me. I'm very well hydrated today, so apparently I don't need it very high at all. But you'll feel a little pulsing in the neck here. And this is a good indicator that you are on the right spot. Not everyone will feel this. Different shapes, injuries, scar tissue, this can cause people to worry that they're not doing this right. But as long as you go right behind the carotid artery, you're in the right spot. You really just want to do about 3 minutes 4 times a day, or one 15-minute session of vagus nerve stimulation. Those are the two kind of ideal choices that you have when performing that treatment. So nice and easy. We only ever really do the left side unless we're dealing with heart or lung problems or migraines, in which case we might go to the right. So the left side is your priority there. The next one is tongue stimulation. And this is still in its infancy as a microcurrent treatment, which isn't saying much because a lot of these microcurrent treatments are, but this is definitely one of the younger ones. And its ability, though, to correct brain dysfunction has impressed me immensely over the years, and it still continues to impress me. This stimulation uses the nerves and the tongue as a shortcut to access the pons in the brain, and bridge out to every other cranial nerve. So consistently, we see significant changes happening in conditions that we would not think we would see, like auditory, visual, sensory, like taste and smell, right? As well as physical changes in balance. And even people that can't speak due to voice issues have been able to resolve those with this as well. So the power of stimulating the cranial nerves, it goes well beyond just this basic idea that was developed by Dr. Norman Doidge, because it is giving us the access to the brain to resolve these cranial issues. Now, for tongue stimulation, you're going to want a tongue stimulator. It does not come with the wire attached, but any wire that's used for conductive pads, you'll see the red and the black pins, will work for this. You do need that though. So you're going to plug in your tongue stimulator. The tongue stimulator comes in the Pinnacle kit, but not in the Evolution one. You can buy it separately. And you're going to plug it into your device. Realistically, any device in our lineup is going to work for this, but the preferred mode is absolutely going to be the Pinnacle, where you can program 199.5 hertz modulated 3-to-1. But the easy way is to set your device to 121 hertz. This gives us the modulation, and it gives us the frequencies we need. So what we're going to do is we take the tongue stimulator, we open our mouth, and we put the tongue stimulator in it. Like so. You put it in on the tongue, one prong on either side of the tongue, and you close the mouth. You will probably feel this right away. It will not hurt, but you will not need to increase the power. If you don't feel it right away, increase the power, but instead of holding it down, just increase it in intervals of 1. You don't want to zap yourself in the mouth. It's very conductive in there. But you hold it in there for about 10 to 15 minutes. Usually, if you're trying to achieve something like improve your balance, you might want to try and walk in a straight line. If you're trying to regain sense of smell, you might want to try smelling some strong scents like peppermint oil. You want to try and engage the brain. Improving vision, maybe you try reading while you're doing it. Something that's going to engage the brain in that area. And then as it's being stimulated, it can notice that there's something wrong, and it can repair that communication system. It's a very, very easy process. Okay, so that is what we call cranial nerve stimulation or tongue stimulation. And I've just demoed that one as well. So pretty easy to do. Lastly is trigeminal nerve stimulation. And this is also known as gamma stimulation. And it may be the most straightforward option because it is kind of hands-free. Its power seems to land on working on clearing out the brain from plaque buildup. And what this does is this really helps with mental health issues such as brain fog, anxiety, depression, mental fatigue. And I'm even seeing some amazing results with people dealing with Alzheimer's and dementia as well. Remember that a lot of this is connected to a lack of sleep and being able to reach that state where your brain detoxes and cleans itself. So being able to artificially place it in that state seems to have that effect, triggering the brain to detox and clean the plaques out. So all you need to do really is place your pads on your forehead. Now, you will likely have received trigeminal pads in your kit. As you can see, I have actually cut one of my trigeminal pads down because if I want to put this on the middle, what I want to do is I want to avoid it getting too close to my temple here where it's going to cause me pain. So for demoing, I cut this one down. Now, what you can also do is you can place them dead center on the forehead, one on top of another. So if you were doing a pair, you might want to do it somewhat like this. It's kind of hard to do it without seeing it on myself, but so that they stack up there. Or purchase the third iPad, which will enable you to have a little dot, essentially. I don't unfortunately have one here, but you'd be able to just plug the third iPad in and it just sits in the center of your forehead. Now, this is different than the book because we have changed this protocol over the years. But realistically, these options are it's just really to prevent any unexpected zapping because the temple areas are very, very sensitive. So you want to use, if you're going to use the pads, you want to use those and you want to set the device to the mode 32-45 hertz, which is the second mode in the Evolution. And it is also in the Pinnacle. It is named the same thing. Now, once you've done this, you want to run it for about 10 to 20 minutes. And you do want to do this daily. People often ask if there's a better time to do this. And I do think towards the evening is going to be best. And that's probably the optimum choice. Now, beyond this, if you happen to have a Hache, you can probably get better results instead of using the pad, doing the same thing and holding the Hache right on the forehead. Remember that the power mostly comes out with the Hache in a more intense way on this lip here, not on the top here, like the manual that comes with the device often describes. So if you want to get the best penetration, lay this flat piece against the center of your forehead and use the Gamma program that way. Same thing, 15 to 20 minutes. This one is called Gamma Energizer. It has a different name because it's a different approach, but it's still about saturating the brain with gamma waves and taking advantage of the power of gamma to detox the body and detox the brain. So, as simple as it may seem, it appears that we do have something for everyone when it comes to neurological conditions. So, if you are suffering from a neurological disorder, you really should give your microcurrent machine a try with one of these simple treatment plans. If you aren't sure which category you fit under, there is no harm in making a treatment plan out of all three of these things and just working on them one after the other. It's pretty easy and it's working on the brain in different ways. So you should not overdo it in doing this. So thank you everyone for joining me today. And if you do have any questions, please just drop them in the comments below. Otherwise, I hope you have a great week and I will see you next week for another Monday 10-minute training. Thanks, everyone. Bye-bye.